Good afternoon, sir. So recently we have seen this case of seborrheic dermatitis in our last OPD, if you remember.
35-year-old female.
Yeah, exactly. So seborrheic dermatitis it represents with red, flaky and greasy lesions, right? So can you just put some light
Yes.
on that case?
Okay, so basically seborrheic dermatitis will usually present with red, flaky and greasy lesions.
Yes.
And there are certain locations like nasolabial fold, inner canthus of eye, eyebrows, scalp, nape of the neck, sternal area, etc. Also, it is due to the overgrowth of pittosporum yeast. Now, I have seen few of the atypical cases of seborrheic dermatitis also, which presented with lower limb lesions, and there were lesions for abdomen. Recently, I have seen one case of atypical seborrheic dermatitis.
Okay, so can you elaborate our recent case, like which?
Exactly. So she's 35-year-old female, came to us with bilateral ear inflammation, mild discharge, and the duration was 3 days. So, according to Ayurveda, with respect to the doshas involved, on the basis of symptoms, it is generally pitta kapha because there was inflammation and there was discharge.
Okay.
And yeah, so this
So
was it.
what are aspect we should cover while treating such cases?
So basically, there are 4 aspects you should remember. As first important is doshas because there is involvement of pitta kapha. Also, your drug should cover krumi-related pathology because it is due to the overgrowth of pittosporum yeast. And lastly, your drug should go raktagat. So these 4 aspects should be covered while dealing with seborrheic dermatitis.
Okay, so as I remember, we have used Swarnaraj Vangeshwar, right?
Exactly.
Describe that, yeah.
Yes. So we have used Swarnaraj Vangeshwar because I have seen big physicians using Swarnaraj Vangeshwar for hydradenitis suppurativa. So basically, it penetrates very deeply. Now, if you look at the composition of Swarnaraj Vangeshwar, you
Yeah, it
remember.
contains, Parak, Gandhak, Navasagar as well as
Vanga, yes. So basically it has Parak, it has Gandhak. Now Gandhak is indicated in Shudra Kushta. Now it has Vanga Basma and Navasagar also. So Navasagar is Shudra Kushta, and for Vanga Basma, which is the hero drug of Swarnaraj Vangeshwar, because Vanga Basma is anti-infective, and when there is pus discharge, Vanga Basma is ideally indicated because Vanga Basma is good for kapha pitta related pathology, it is good for twacha, and it goes to the dhatus for rasa rakta related dhatus. And also Vanga Basma can be used when there is eczema, and eczema with secondary bacterial infection is the right choice where Vanga Basma can be ideally indicated, or basically bacterial eczematization. And lastly, when I read Rasatantra Sar for this video, I found one indication of Vanga Basma, that is when there is Krumi Janya Karnapak, which exactly fits with our pathology of this 35-year-old female. Vanga Basma can be the choice. So basically, these are 3-4 indications of Vanga Basma or Swarnaraj Vangeshwar, which can be used in infective pathologies, just like seborrheic dermatitis.
Yeah, and we also added up with her Arogya Vardhani.
Yes, we
which
gave.
is Pitta Kapha Shamak.
Exactly. So Arogya Vardhani is Pitta Kapha Shamak, and all other drugs are Pitta Kapha Shamak. And but she responded in 3 days only, and even she was very happy that she got results in just 3 days. So this is how it is. Like if you are using the bhasmas in right dosage and with right indication, with respect to right indication, you will get results very fast.